Gauteng MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, together with the Deputy Minister of Home Affairs, Njabulo Nzuza, welcome Christmas babies and also encourage South African parents of newborns to register their children within 30 days to ensure that they can access services available to them. So for more on this, we're going to be joined by reporter Calvin Dludla. Calvin, a very good morning to you. Merry Christmas on your end. Perhaps you could bring us up to speed as to what's happening. What are the numbers trickling in terms of the babies being born, and also just some of the concerns arising at this hour?
Good morning to you, Lizel, and to our SABC viewers at home. Merry Christmas to you, Lizel, and to our SABC viewers. We are here in Tembisa Hospital. We were told that 11 babies were born on this special day. But let me introduce the Deputy Minister of Home Affairs. That would be Mr. Njabulo Nzuza, who is also here. Thank you very much for your time. You look good. You are also wearing a Christmas hat. Thank you very much for your time. You are here to monitor the situation. How are things so far? I saw you were also handing over certificates.
Yes, we are very happy to be here in Tembisa Hospital. This is part of our partnership that we have with the Department of Health, where we have Home Affairs offices in the Department of Health in the hospitals where babies are born. The hospital we are in gives birth to about 16,000 newborns every year, and then it's important for us to make sure that those newly born, we give them birth certificates, because that's where their life starts. We are happy that today we have 11 births that have occurred. Out of the 11 births, 9 of them are South African, which means that we have issued out birth certificates for those ones, and I think it's very important and very joyful for the country that on this Christmas Day we are introducing 9 just in this hospital alone to be in the population register, which means that South Africa is growing. We urge mothers to never leave a hospital without having taken a birth certificate for their children, because it's very important. We don't want to meet a fully grown person who is a South African who says, I don't have identity because they did not take a birth certificate for me. So for us, it's very important. We are quite excited to welcome the new entrants into our population register by giving them the birth certificates that we've done. So today, our offices are open in health facilities. We urge our citizens to make sure that they use those facilities.
You know very well that your offices, in most cases, they are known to be full, and people are, sometimes they complain when it comes to services. You come at 8, you leave at 4 without even getting help, especially when it comes to mothers who are still fragile. Now you are visiting hospital, Deputy Minister, to hand over certificates. Is that strategy working? And I also visiting other hospitals, because there are so many babies that were born, especially today. And also my question to you is that, are you also doing this on Christmas Day, or is it a daily routine?
It's a daily routine. Where you have a hospital which gives birth to more than 5,000 births, you have a Home Affairs office. So it's not something that's happening because it's Christmas. No. It's forever there. That is why we're urging mothers to never leave a hospital without having to register their children. And what is most important is that it takes away traffic from our other offices. So it means these offices are mainly dedicated for birth registration. And they are not just in public hospitals alone, but they are also in private hospitals. But now we are taking it a step further, because we are going to soon be announcing that we are eliminating paper in the process of the applications to make it much easier. So the process of making things easier and doing things digitally is the direction in which we are going now. But we have presence in all over the country, more than 1,000 hospitals where we are found. In some of them we even visit to take applications, and then later we give you a birth certificate. These birth certificates I was issuing here, they are printed on the spot. You don't have to wait and go home before you receive it, but we go to our office, you register the birth, we give you the birth certificate before you leave the hospital.
Your department is also known for errors. There are those who have been complaining about Home Affairs, saying that sometimes they get wrong ID numbers, wrong names and everything. Others would say, I was told that I'm married and I'm not married. My name is Simon, but I'm called Zakele. How do you minimize that, especially when introducing certificates to such manage young kids now?
Well, I think you should take more interest in the work that we do most recently. The things of having mistakes are a thing of the past. You won't have a newborn child where you'll say that we've issued a wrong birth certificate. No, we no longer have those things. The ones that will help will be legacy issues, and we consistently deal with those wherever mistakes have been made. But in terms of what we do now, and the work is very much up to scale. If you notice, even the complaints when it comes to the queues, over the years, those complaints have been going down because of the systems that we have introduced. Part of them is the booking system, where people can actually book for appointments, and on the day that you arrive, we actually service you because we know that we have made that particular booking. But for us today is a great day. We are introducing new people who are born on the 21st, which is the same day Jesus Christ was born, into the population register, which means that our systems are improving and they are becoming more and more efficient because we print these birth certificates on hospitals. This is not the only place where we are printing them. Throughout the country, where we have an office in a hospital, we are printing them.
You have been engaging mothers here. What are they saying? They seem so excited.
Yes, the mothers are very happy, and we are happy for them, for their newly borns, that as they leave the hospital, they are living with birth certificates, which means these are people who are already in the population register. But I'm sure you will hear from the mothers themselves the convenience that they have actually faced with us coming here and with having a Home Affairs office here.
Thank you very much.
Thank you.
That was Deputy Minister of Home Affairs, Njabulo Nzuza, explaining about the process of issuing a new birth certificate to these mothers. Let me introduce Health Minister in this province of Gauteng, Nomantu, Nkomo-Ralehoko. I see you are very happy, also wearing a Christmas hat. Merry Christmas to you and the staff. You arrived early here and you monitored the situation. You had the briefing. What are they telling you?
You know, I'm excited because when I arrived already, DM was already here and I had to brief them about the work that we've done in Tembisa Hospital. Remember, I always not hide where we come from in this hospital. But now the improvements that we've done, I don't want again to not stop talking about them. So my briefing was basically about the institution and the number of people that we are servicing here, the disciplines that are here, the improvements that we are doing, even in terms of infrastructure, because you can see now that there's a lot of infrastructure improvements that we are doing in Tembisa. But again, the motivation that we must do to our staff that is working here, because they are human beings too. They need to be told when they are doing good. So it was part of the briefing that we were doing this morning.
You are engaging mothers, new mothers here, welcoming new babies. I saw you also had gifts for them. What are you bringing them?
I was so excited about the mothers. I'm a mother too, so when they are sitting in those beds, I know you need each and every person that can come and say to you, this is what I'm bringing for your child. So the excitement and the tears of joy that we have seen to them, it's because of the good work that we are doing. But the good work that this government is doing, because we don't talk about these good things, that 16 kids in a financial year that are given birth here in Tembisa. They don't just do those things alone. There is a number of people that are helping them, the staff that is behind them. But again, the treatment that they are getting now in the hospital, it's out of this world. It's a service that is expected when you get into the gates of Tembisa Hospital. So these mothers are happy. That's what they were telling me. They were crying indeed, tears of joy. They are happy about their bundles of joy again, because when you go home having that thing that you are holding, that you know you are going to watch the development of that child on daily basis as a mother, this is something that will never go away. Another thing that I'm encouraging them to do is to breastfeed, because once you start breastfeeding, you get closer to your child. And all of them, they are going to breastfeed, as they were indicating to me. One of those that may not because of the health reasons, but 99% of the mothers were encouraging to do that, and we're teaching them again. One other thing that we've picked up, usually when I get into these wards, you find 13-year-olds, 14-year-olds holding babies. But you can see here, we don't have young children today in Tembisa Hospital that are having children. Maybe there will be one or two that can come after this. But on a Christmas day, I didn't get that incident, because that's another thing that hurt me so much when I see a 13-year-old or a 14-year-old holding a baby, because for me, it says that child didn't want to have that child. And it destroys the life of that child once he has a child whilst he's still a child. Too, I even say them, you are a child, but you have a child too. Definitely there's something wrong. But we will always have counseling sessions that we do to them once we find that environment. And sometimes, because we know that there's something wrong that has happened to the child. And again, I was briefing the minister in the morning, with DM in the morning, that we even now become friends of the courts as the Department of Health, because we want to take the information that we have, the files that we have, and make sure that the courts must know that this child was raped if the child is having a child at a 13-year-old. There must some intervention that the social development must do, Department of Health must do, Department of Justice must do. So we work in collaboration, including Department of Home Affairs. So this collaboration, we really appreciate it. Indeed, even here we have 16 offices, and in all the hospitals where you go, Home Affairs is just right next to the area where mothers are, and we really appreciate that collaboration, including when we go out, by the way, to communities. In my program that you always follow me, of local health promotion programs every week, Home Affairs is there with their trucks. They even assist the children that comes there on the spot immediately when they find that this child has been born in Krisani or another hospital, but they don't have birth certificate. They are with us in those outskirts, in the townships, in the informal settlements. So it's the collaboration that this government is doing that we must appreciate, all of us.
Yes. Last time when we had an engagement with you in Pretoria, you were opening, I think, a new ward, and you told us that now we are bringing infrastructure, top-notch infrastructure in hospitals, especially in government hospitals. You can tell us now, are you happy with the infrastructure and the conditions of work here?
I'm happy with the infrastructure of the ward that we've renovated. This one is an old ward, you can see, but you can see it's clean, but we are going to renovate this one, because you can see the ceiling. Already there are some leaks that in the ceiling that you can see. But we are going to, I think, about 3 wards that we've identified in this financial year that are going to be renovated to be the state-of-art wards that we're expecting. Almost all the hospitals, that's what we're doing. That's why on the 1st, I want you to come and open that newly built one at Bara for young children, by the way, for the PEDS unit. Yeah.
Thank you very much. That was Mrs. Nomantu Nkomo-Ralehoko telling SABC News that she is encouraging mothers to breastfeed. Let me just go to them now and engage them. Thank you very much, Mama, for your time. Do you prefer to speak to us? Okay, thank you very much. Mama, siyaphila njani? Siyaphila.
Siyaphila njani?
Nkosi yami siyabonga, nkosi yami. Awu umama ubani?
Sinazo Mbizo.
Oh, usinazo. Nkosi yami usesibhedlela manje, usuthola umntwana, umntwana muni?
Umfana.
Bakithi ubani igama lakhe?
Leniko.
Bakithi nkosi yami, uzizwa unjani nje ukuthi ke uthola ingane ngosuku oluChristmas?
Ngizizwa ngimnandi kakhulu, bengalindelanga lelanga kumntu azizwa ngikhala, ngaliswa ukuthi ngijabulile.
Ngiyabona ukuthi uyakhala, bengisayibuza ngoba ngikhuluma no-MEC ukuthi umama ukhalelani ngoba lesi isikhathi sokujabula. Merry Christmas to you and to your new baby. Are you happy that manje usunengane encane uyithole ngosuku oluspecial kanje? Injani treatment yala esibhedlela?
Emnandi kakhulu, basiphethe kahle abanesi, bese right, yonke into beyi-right.
Ingane kavu ngiyacabanga uyafuna ukuyibona bayivuka manje. Ngiyayibona ingathi salele khathele.
Ilele khathele.
Nkosi yami sikudedele mama, nawe uphumule ulale, unakekele ingane, umnakekele umfana, umthanda, umkhumbuze mayisekhulile ukuthi babe khona beindaba bezokubona wena usazalo.
Yes, ngiyabonga kakhulu.
Thank you very much. As you can see, excited mother Lizelle there telling that she was actually not expecting the baby. Let me try and engage other mothers here. I can see most of them, they are awake. Now, sawubona mama.
Sawubona bhuti njani?
Njani mama?
Ngiyaphila.
Bakithi nkosi yami, ngiyambona umntwana, ngiyambona ubani igama lakhe?
Oratile.
Oratile.
Yes.
Bakithi umama yena ubani igama?
Melithanga noNkulu.
Uzizwa unjani nje mama, usutetile iChristmas, kukhona no-MEC no Deputy Minister bazonibona? Ngiyabona labaniphi ama-gift niyawathanda?
Ndiyawathanda. I'm actually very grateful for the gifts. I'm super happy and ecstatic about the birth of my son today. It's a blessing indeed. I didn't think I was going to make it yesterday. I didn't think he was going to make it yesterday. When the nurses told me that he's struggling to even push through, he's losing his fight. So I'm very grateful for everything, and it couldn't be a better gift for me on Christmas Day, you know? Yeah.
Merry Christmas.
Merry Christmas.
Merry Christmas to the son as well.
South Africa.
Thank you very much. You are happy here, you are comfortable?
I'm very comfortable. The nurses have been super ecstatic. They've prepared us so well, even for today, prepared the babies as well, even the whole birthing process. In fact, they just with you right throughout. Like I said, I almost had complications with my child giving birth, where they said that his heart rate is beating too fast and he just can't push through anymore. They needed me now to start intervening, and they were like, you have to walk out here with your baby, and they ensured that I actually do walk out with my baby here this morning at 10 to 1.
10 to 1.
So I'm very happy. They were like, you have to leave this hospital holding your baby. It's imperative.
So just after 12?
Just after 12, I got my baby.
That is wonderful.
The best Christmas gift ever that I could ever ask God for.
Wow. So he's sleeping now, tired?
Sleeping now. He's probably going to wake up very soon and start wanting.
I'm sure you can't wait to hold him.
I've been holding him all morning.
No.
Yeah, I only put him down when you guys came, but I'm very happy.
Okay, thank you very much, Mama. Enjoy, and then you have a Merry Christmas, and hopefully, and a Happy New Year. You have to raise this baby very well. It's a gift on special day, the 25th of December. One of the mothers here, Lizel, telling SABC News about certain complication that she had earlier when she was about to give birth, but telling SABC that she is grateful that she did manage to get the baby. Thank you very much, Mama. Sanbona. You can tell us, Mama, I see your face is glowing, and I see the child is sleeping there. How are you feeling? How are things here?
Nditwa ntsake ngopfu ku va ni kume n'wana hi ti 25 ta December 2024. Ni twa ku ri nyiko yo huma ka Xikwembu, n'wana loyiwani se na khensa swinene. Ni khensa na ti-visitor leti nga hi visitela ku ta hi tsakisa eka siku ra namuntlha, na lava nga hi lunghizela la ku saseka ku vekeliwa tibaloni ha va khansela.
Imani ubani gama lakhe?
Vito ra n'wana i Ronewa Chauke.
Umfana ntombazana?
Mfana.
It seems as if they are giving birth to boys here.
Mfana.
Okay, you are happy now, you are relieved that you have a baby. When did you get the baby? When did you give birth?
25.
Yeah, like time you don't know.
Past 12.
Past 12. Okay. No, thank you very much, Mama. I see there is a gift there for you from the MEC and the minister. Are you happy? Are you comfortable? How was the treatment here in hospital?
Ntsaki ngopfu leswi va nga hi khomisa swona la xibedhlele. Ni twa ni khensa swinene. A va endli ntirho lowu ku ya emahlweni va endla na van'wana lava nga ta kuma n'wana hi ti 1 ta January.
Okay. Bathini ekhaya? I'm sure bajabule. Subatshelile.
Angibatshelanga ekhaya because anginafoni lawani, foni yami lesebhekeni.
Mele bakunike ubafonele ekhaya ubatshela ukuthi umfana usefikile uRonewa. Thank you very much, Mama. Siyabonga kakhulu ngesikhathi sakho. One of the patients telling SABC News that he got a baby by the name of Ronewa, saying that she gave birth rather at around 12:30, but she is telling SABC News excitedly so that she has not informed relatives at home because her phone is not here, but excited that she got a baby on the 25th of December 2025. Mama, thank you very much for your time. Siyabonga kakhulu. Mama, let me talk to you. Kunjani?
Njani?
Nami ngimfukile. Ikhona ingane manje ifikile. Siyabonga kakhulu isikhathi sakho no, but sizama ukuqhela. Thank you very much. As you can see, Lizel, those are some of the babies and their mothers that were born on the 25th of December 2025, a Christmas day. Indeed, they are telling us about the challenges, some of them telling us that they had some complications, Lizel, but I can tell you that, as you have seen, the Deputy Minister of Home Affairs, that would be Mr. Njabulo Nzuza, is also here issuing certificates. He did tell SABC News that it would be easy for them now just to get certificates instead of going to Home Affairs offices to queue so that they can be able to get those documents. We are here, and I have to say, in this ward post-natal care unit, that is what they told us. We are here and we are monitoring the situation